Well, the pandemic has taken a physical, mental and emotional toll on doctors, nurses, healthcare workers and caregivers. And definitely this can sap the energy out of these caregivers and expose them to compassion fatigue, that is a chronic physical and mental distress and exhaustion. Gladys Gashanja has more on how to safeguard one's mental health during these testing times.
Compassion fatigue, simply put, is the stress resulting from helping or wanting to help people who are experiencing trauma or suffering.
So as they take care of them, they take in the stress, they take in the pain, ending up developing other mental health conditions like burnout, post-traumatic stress syndrome, and anxiety disorders.
Doctors, nurses, healthcare workers and caregivers across the world are facing the pandemic by embracing long working hours coupled with limited resources, putting them at risk of physical and mental exhaustion and in some cases compassion fatigue.
Physical symptoms are extreme fatigue, having a lot of headaches, loss of sleep, change in the sleep routine, emotionally feeling irritable most of the time and reduced level of empathy. You feel like you're not able to take care of that person anymore, and also the sense of depersonalization that you're losing yourself in the middle of all this, and the level of apathy that you don't feel connected emotionally to the people who are dealing with this condition. And it can also be experienced through having nightmares as well.
The COVID-19 has had far-reaching effects, with headlines rubber-stamping the number of casualties and disruptions caused. This puts the mental well-being of many at risk.
Journalists being able to report about the condition over and over again. We have the families of the individuals who have contracted COVID-19, because being in a place of uncertainty of how will the condition unfold, will they get better, and in being in a place they're not able to see them, they're not able to visit them.
Experts warn that when caregivers do not practice self-care, it can lead to depression, isolation, substance abuse, among other self-destructive behaviors.
It's okay to feel overwhelmed right now. It's okay to be in worry. It's okay to be in fear because of the uncertainties. But those are things that are beyond your control. How about focusing on things that are within your control? What can I do at this time? I can choose to switch off the news and limit my time on social media and connecting with friends virtually. Booking for a therapy session, that is what we are currently doing right now. And just being vulnerable to talk about your fears and concern. Because at the end of the day, we are trying to aim on the best coping mechanisms.
Gladys Gashanja, NTV.